You are giving sign out after night shift in the intensive care unit. This patient is on maximal support. That one, family is discussing goals of care. Another is ready to withdraw support. Join me for the rest of today's episode to discuss how, in these difficult times, you can care both for your patients and yourselves. Welcome to the Med Ed Well podcast, where physicians get empowered to take the next step in their wellness, personally, professionally, and financially. I'm your host, Dr. Ryan Stejink, a practicing general pediatrician and online entrepreneur. Thank you so much for joining me here on another episode of the Med Ed Well podcast. We're already to episode 29. I'm so thankful for you listening, subscribing, and sharing these episodes with other physicians, students, and those in medicine. Are you looking to get home sooner and become more efficient in your medical practice? Check out my free guide, Maximize Your Clinical Efficiency. You can get your free PDF guide at mededwell.com/efficiency guide. You'll also get my weekly emails that I've been a lot more consistent in sending out. And I'll tell some stories and invite you to share and to check out the current week's episode. So I'd encourage you to check it out. The link is in the show notes. Today, we're going to be talking about grief and death from the perspective of the medical team, those providing the care. So a caveat and a little context. As a general pediatrician in an outpatient clinic, while there are occasional codes, my experience in walking patients and families through these difficult times was primarily in residency and reflecting on my own experience going through loss. These things have changed my medical practice, but many of you will have had different experiences. Many of you have walked these journeys daily, weekly. So this is not meant to be the perspective, but rather a perspective, mine. So feel free to reach out with feedback and input on this really sensitive but important issue, caring for our patients and ourselves. Wellness can be a really complex journey, navigating hard situations and emotions. I invite you to join me for the rest of today's episode to begin this conversation. Before we dive in, though, let's hear from today's sponsor. Disability insurance is complicated. Doctors shouldn't have to take time to sort through a bunch of insurance quotes to find the best policy. Don't stress over insurance shopping. Let Pattern find the best coverage for you at the most affordable price by visiting patternlife.com/mededwell. That's patternlife.com/mededwell. The link will also be in the show notes. All right, now back to today's show. I'm so sorry. Is there anything else we can do to help your loved one be more comfortable? Maybe switching off the monitor alarms, giving your family space, time for goodbyes, maybe arranging a video call if there's restrictions or time remaining is a barrier. Walking patients through these times can be both a burden and a sacred privilege. Not only do you get to help patients in one of their most vulnerable times, but you can impact others around your patients. Compassionate care shows the value of individual lives. My grandmother had good inpatient hospice care at the end of her life, and I was encouraged knowing that she was well cared for. But walking patients and families through these situations on a regular basis, often with a lot of chaos, these can lead to compassion fatigue and burnout. So what things can help you care for others and to care for yourself as you face death in the context of medicine. First, what physicians and other medical professionals need to know to come alongside patients. In the moment, this may be having the family present for the code, if they want to be. Maybe giving bad or even unexpected news in a way that's sensitive. A group of oncologists in Texas published an article in 2000 that laid out kind of a framework for giving this bad news. I remember covering it in medical school, and their acronym was SPIKES. I'll have a link to the article in the show notes. So S was for setting up the interview, having a good location and appropriate privacy. P was for getting the perception of the patient, what they understood about what was going on, what their prognosis was, what tests were being done, and whether that was concerning for cancer or something else. I was for obtaining the patient's invitation. Are you ready for me to share? Maybe they want someone else to be there or to be the one receiving the initial news and then to relay that shortly thereafter. K was for giving knowledge and information to the patient. E was for addressing patients' emotions with empathy. And S was for strategy and summary. What comes next? I found this really helpful in my own medical practice as I conceptualize some of these things, whether it's bad or unexpected news. Additionally, coming alongside others can simply mean saying, "I'm so sorry for your loss. I'm so sorry for this diagnosis." And then sitting quietly with them, or just giving them space to process what you've just said and coming back in a few minutes. It's okay to show emotion yourself, either at the time or later. My experiences with miscarriage and loss have helped me be more sensitive as I see newborn babies, especially as I review the chart in advance. Mom's gravida and para status, the G's and P's, include how many prior pregnancies and then how many term pregnancies, preterm, any abortions, spontaneous or induced, and living children. So these numbers don't tell the whole story, but in the midst of postpartum depression screening, I often ask now, how many children do you have? Not, is this your first? Or maybe it's saying, I was reviewing the record and I saw that you may have had a loss. I know there can be mixed emotions sometimes bringing a new baby home and missing the one that you aren't holding. It may look different in different situations for you, for me with different families, but these are some ideas to get you thinking. How can you be sensitive to some of those things? So first, when facing death alongside patients and families, these are a few things to keep in mind. But then, number two, when you're in these situations, make sure to engage and process your feelings. You are a real, whole person, not a robot. Maybe this looks like debriefing with your team, immediately or soon after. It may mean that you take time to reflect on what happened, about this person who is no longer with you, no longer with their family. That's a lot to process. Even with peaceful deaths, though death is universal in this world, it is not natural. It just feels wrong, and that's true. It's traumatic, and it's okay to say that. So in facing death with patients, first, a few things for coming alongside patients and their families. Number two, engage with and process your feelings. But number three, get help. kind of goes with number 2 about engaging with your feelings, but it means that you can't do this all alone. It could be having the chaplain stopping by the floor not just for the family, but also for the staff, for the team, maybe as needed or a particular structured time. Talking with colleagues, yes, with appropriate confidentiality, but maybe just sharing that you've had a really hard day and about the patient that you've lost. It may mean that you proactively offer help or seek out help when a patient has passed away. Maybe you say to a colleague, "Hey, I'll take the next admission for you if you just need a moment to sit and process." It can take strength to ask for help, but we all process things differently. So your response might differ from mine. After losing my boys at 19 weeks, when I came back to work, a colleague offered to see my patient if it was twins or something else that was too difficult for me as I came back. They said I just had to say the word bananas and they'd take over for me. This offer showed me a lot of care and I really appreciated it. So what's your takeaway? What would you like to implement? To change? Maybe it is how you come alongside your patient or their family. Maybe it's engaging with your feelings and getting help to do that. Imagine how this could look if you put this into practice. What would be different? Would you have less compassion fatigue? Less burnout? Less moral injury? Would you be able to maintain empathy and your connection to your why in medicine? Put some of these things into practice, and then email me or message me on Instagram to let me know how it went. Thank you so much for joining me here on episode 29 of the MedEdWell podcast. I really want you to take the next step in your wellness and implement some of these things. Please subscribe, share, and review the podcast so more physicians, students, and medical professionals can get the help they need to take the next step in their wellness. I also want to encourage you to sign up for my email list and get the free guide, Maximize Your Clinical Efficiency, so that you can get home sooner. Also, check out today's sponsor, Pattern Disability Insurance, to get a quote today. Again, thanks for joining me here for this important discussion. Thanks so much for all you do, and have a great day. And now for our important disclaimer. Dr. Ryan Stejink is a practicing general pediatrician, but the MedEdWell podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell podcast, and have a great day.